First, I'm going to insert a nasogastric tube. And the first thing I would do is check the order, gather my supplies, and ensure that I had the proper NG tube. Then I would wash my hands and don PPE if indicated. I would provide privacy by closing the door or the curtain, and I would explain the procedure to the patient, let them know that it's probably going to be uncomfortable, what we can do for it to be more tolerable, interventions that we can take, and ask if they have any questions. I would then raise the bed to a comfortable working height and position my patient so that they are in high Fowlers if they could tolerate it. If not, then I would put them at least a 45-degree angle. I would get a trash can and put it close by. I would have an emesis basin and tissues ready for my client, and then we're ready to start the procedure. So I would put on gloves, and it just has to be clean gloves. I would measure the tube from the tip of the nose to the tip of the earlobe to the tip of the xiphoid process. And then I would mark the tube with an indelible marker. Okay, let's pretend that's at 60. So then I would ask the patient, I would check the nose to see which nostril I wanted to use. And I would ask the patient to flex the neck back against the pillow. I would lubricate 2 to 4 inches of the tube with water-soluble lubricant. And before I did that, I would drape the patient with a towel. So I would drape them, and then I would lubricate 2 to 4 inches of the tube with water-soluble lubricant, know which side I wanted to use, and I would insert the tube in an upward and backward motion along the floor of the nostril. Then I know the patient would be tearing and be uncomfortable, so I'd offer emesis basin and tissues. And then if coughing, if I'm at resistance, I would rotate the tube. If coughing or gagging, once they start to cough or gag, I would check the placement of the tube with a pen light and a tongue blade. And if the tongue is coiled in the oropharynx area, I would straighten it. Laryngopharynx area, I would straighten it. And then I would have them tilt their head to their chin. And if they're NPO, I would have them swallow. If not, I would offer them sips of water. And I would keep advancing the tube in the backward and downward motion. And if there were any signs of distress, like as persistent coughing, gagging, cyanosis, inability to hum or speak, I would stop the procedure immediately and remove the tube. I'll keep advancing the tube until I got to the marked spot, which is a really long way in this tube. And once it was there, I would check for placement, and I would do that by aspirating, putting a syringe in here and aspirating, checking for color and content, and checking the pH. And I would use either drops of the aspirate on pH paper or in a cup, and then I would let that sit for 30 seconds and then compare it to the chart to make sure that it was where it needed to be. Then I would obtain an x-ray per order or per policy. And then once that was confirmed, I would mark it with the indelible marker at that spot. I would remove my gloves, put on skin protectant on the nose, and before I did any of that, when I got to the point the first time, I would have loosely secured the tape to the nose to make sure this didn't become dislodged during transport or anything. Then, so after it's confirmed, I would mark it again. I would take off my gloves, apply skin protectant to the nose, reapply gloves, which I wouldn't have to do yet, okay. And then I would take a 4-inch piece of tape, split it halfway up, 2 inches and vertically in the middle. I'd place the intact part on the bridge of the nose and then wrap the 2 split parts around the nostril, not too tightly to secure the tube. I would remove the syringe. Well, I would then reapply my gloves, remove the syringe, attach this to suction or cap it, whatever the order states. And if it's a Salem stump, I would ensure that it is above the stomach level, usually around the shoulder. Then I would check my patient or provide oral care. I would gather my supplies, throw away my gloves. I would provide oral care every 2 to 4 hours, lubricate the lips generously, check and clean the nares and moisten the nares as needed. Before I left the room, I would put my patient in the lowest position, the bed in lowest position with the side rail up, and I would make sure they had everything they needed, call light, they were comfortable as possible, and I would remove my gloves. I would find all my stuff in this trash can. Remove my gloves and wash my hands.